歡迎大家。
Welcome to today's press briefing of the expert committee on clinical events assessment following COVID-19 immunization. To meet the media, we have with us Professor Ivan Hong, Dr. Lee Kwong, Dr. Ronald Lam, and Mr. Frank Chen. As at the 7th of March, altogether under the immunization program, about 93,000 doses have been administered. For Sinovac, for the first dose is about 91,800. For Comirnaty is about 1,200 doses. Of those people who have been inoculated, those over the age of 60 account for about 64%. Under 599K, in the use of vaccination, the Secretary for Food and Health has already been empowered to set up a surveillance system before the inoculation system is put in place. We have a surveillance program under the Department of Health. We receive reports from the healthcare sector as well as from private clinics about any adverse events following immunization. In relation to rare adverse events as well as serious adverse events, we have set up a system under which a causality assessment will be made. Well, as at 4 p.m. on the 6th of March, the DOH has received 16 serious adverse events. It includes 16 non-serious adverse events, mostly about headaches. And there are 45 that involve admissions. They are non-serious adverse events. In relation to these adverse events, after vaccination, we attach a lot of importance to them. Let me remind the general public that when they make an appointment to get inoculated at these vaccination centers, please pay attention to this. We have sent out messages on the internet on information of contraindications stated by the Joint Scientific Committee as well as pharmaceutical companies. There are people who are not suitable to receive the inoculations. For people who have a serious allergy history, they are allergic to more than one medicine, or they have had a serious reaction after inoculation, they are advised to first seek medical consultation before deciding whether to get inoculated. There is a second group that we'd like to remind them. If you suffer from chronic illnesses or some illnesses that you're not sure whether you can get the inoculation, then go to talk to a doctor, get an assessment done before you decide whether you get inoculated. In relation to the expert committee on clinical events assessment following COVID-19, I thank the two co-conveners, Professor Ivan Hong and Dr. Lee Kwong, for their contributions. They have been discussing about a recent adverse events following immunization, and I will defer to Professor Hong about the findings of their discussion. On the 6th of March this year, as well on the 7th and the 8th, the Department of Health has received reports about 4 serious adverse event cases, including 2 death cases and 2 cases where the patients are now staying in the ICU. For the first case, it's a 55-year-old female. On the 6th of March, she passed away in a public hospital. According to the record, on the 2nd of March, the patient has received CoronaVac The preliminary finding is that the cause of death was acute coronary infection. In relation to the information we have, the expert committee is aware that the patient suffers from chronic illnesses, including hypertension as well as hyperlipidemia. An autopsy will take place. The DH will make an application to the coroner's court to obtain information of the autopsy. It's been granted. The information we've received is that there is a lesion in the major artery, which in turn caused a lesion in the artery in the neck, and it has caused some kind of stroke. The expert committee has gone through the information, and they have also referred to relevant information, medical history, as well as the information relating to the inoculation. There is unanimous opinion from the committee that there is no direct causality between inoculation and death. The expert committee will have to take a thorough look at the coroner's autopsy report before giving a final finding. The other case is a 60-year-old male. On the 6th of March, the patient is now in an ICU. For the preliminary diagnosis, it's an acute coronary syndrome. On the 1st of March, he received a dose of CoronaVac. The expert committee is aware that the patient suffering from chronic illnesses, including diabetes, carotid atherosclerosis, hypertension, and stroke. Gauging from the chronology and relevant information, the expert committee is in the opinion that there is no direct causality between inoculation and the condition of the patient. We'll continue to follow up on the information and refer to relevant report to decide on the causality. I will now report to you about a third case. It's a 72-year-old female on the 6th of March. She's receiving treatment in the ICU. The clinical diagnosis is a condition that involves high blood sugar. On the 6th of March, she received a dose of CoronaVac. The expert committee has referred to available information, medical record, clinical reports, clinical data, as well as information related to the vaccine. And they will conduct an assessment on causality. The committee is of the opinion that CoronaVac may cause a lethargy, but the most likely cause of this patient is that the patient has stopped the injection of insulin. The other one is a 71-year-old male who died on the 8th of March in a public hospital. From the record, it shows that on the 3rd of March, he received a dose of CoronaVac. The expert committee has also looked at available information, including medical record, clinical data, information relating to the vaccine. The patient died very shortly afterwards. We need to obtain autopsy information before we can make an assessment. We know that the case has been passed on to the coroner's court. We hope that an autopsy report will be available shortly so that we can conduct the causality assessment. I would like to give you some background information. from the data in 2018 in Hong Kong, every day, well, people who died from diabetes and complications is 1.3 people. Those over the age of 70 is higher. The figure is higher. In 2018, the average daily deaths from corona illnesses is 10.3. In relation to lesion in the artery, there are 369 cases, so about 1 per day. In 2020, admission because of myocardial infarction is about 7,300. In relation to acute stroke is about 10,003 cases. Now we open the floor for questions.
I'm from Now TV News. Regarding the case of the disease age 80 with the carotid atherosclerosis, he got the jab. Would it be his reaction? Would it be triggered? Would it have been triggered by the vaccine so that there was inflammation and so his artery was more prone to lesion? There might not have been a direct link, but would it be the case that indirectly his blood vessels were affected? And then regarding the latest case today, the latest case of death today, do you have more information? Did he consult a private clinic? Did he get the injection there? Did he have any chronic diseases? Well, in fact, in this case, he went to a doctor, he consulted a doctor, but still he died after the vaccination. So what is the relationship with the inoculation? And then for the case of the 72-year-old, it was said that probably it was due to her failure to have insulin. But would it be the case that the vaccine triggered a worsening of his diabetes and thus resulting in the diabetic ketoacidosis? And did you invite any experts in diabetes to participate in your discussion today? Well, today, when we had our meeting, we did have colleagues from the ICU as well as the cardio department. I think you were referring to the 55-year-old lady lesion of the artery. Well, the vaccine had got nothing to do with the lesion of the main artery. Regarding the other vaccines, like the vaccines against influenza, etc., as to its relationship with inflammation and triggering of inflammation, we haven't seen such a relationship. Well, having got vaccinated against influenza, in fact, contrarily, it would reduce the risk of inflammation and you would reduce the triggering of cardiovascular diseases and or cerebral vascular diseases. And in fact, such information could be found in medical journals. Well, if I may supplement to the information of the questions. Well, it was a case of HHS, hyperglycemic hyperosmolar status. So that's what we call the ketoacidosis. After getting vaccinated, you may get tired, but then for diabetic patients, if they feel unwell, I don't think they should take their own initiative to stop insulin injection or change the dosage because that will affect the level of blood sugar. Well, after vaccination, if anybody feels unwell, you should consult a doctor as soon as possible to see if you need any follow-up treatment. As to another case, round about midnight today, a 70-year-old patient passed away at United Christian Hospital. According to our information available, for this particular male patient, in the past he did not have any major diseases. he got the injection at a private doctor's clinic. At this moment, we haven't come to a firm diagnosis. Well, between calling 999 and arrival at the emergency unit, within a short period of time, he passed away. So the case has to be passed to the coroner's court for a detailed examination before we can know the reason behind the death, the cause of the death. Sorry, the speaker doesn't come through. Well, regarding as of 4 p.m. on the 6th of March, there were 16 non-serious adverse events, tiredness and headache, and then 45 admissions. They are also non-serious. Also, like dizziness, chest pain, and palpitation, conditions that aren't too serious. Well, the gentleman at the back, I'm Chu from Hong Kong 01. My first question is about the cases. For the first case, I think his death was almost a week ago. What about his full autopsy report? Can you even rule out the indirect link with the vaccine? As to the third case, that is the 71-year-old man. Just now you told us that he didn't have any major chronic diseases. A report said that 20 years ago he suffered from a thyroid problem. Now people are worried that they may go into a shock. Well, in this case, he became unconscious during his sleep. He had the vaccination on the 3rd of March. Was it at Kai Ching Estate? Is a family doctor, is a private doctor. So was the doctor aware of his medical history? So he had consulted a doctor and still, unfortunately, he passed away. If it is proved that there is a link with the vaccination, will the relevant doctor be made responsible for his death? And then yesterday, the lady was allergic to prawns, and then he had hives after getting the vaccination. Now, just now you talked about the benchmark figures, the number of yearly deaths as a result of diabetes. Are you going to make announcements about the benchmark figures, which also include the figures of people passing away as a result? For BioNTech, they have to provide regularly the figures. Will there be a breakdown about the number of deaths, like people dying and with a history of diabetes or heart diseases? Just now, you have given the figures of 16 plus 40 plus cases. Have you checked all those cases, and are you sure that some of them are related? And then for the patient who skipped 2 doses of insulin, and then there was a kind of poisoning. So what is meant by not under control? If she skipped 2 doses and then she had a problem, would it be tantamount to not under control? Many people would like to get a definition about something being uncontrolled. Are you going to tell us? If not, what are you going to do? Let me take your first question. For the 63-year-old patient who passed away, well, this morning I did talk to the pathologist at QH. I had a word with that doctor. I also went there to take a look of the autopsy last week. Well, the result is the same. That is, the patient had serious coronary heart disease, and so there was a serious case of myocardial infarction, and then pulmonary edema, and then heart failure as a result. For further and more detailed pathological examination, etc., is still ongoing because it takes time even if we can have a specimen, we still need time to go through the pathological process and the chemical process. It is hoped that we can come up with a full report, and then we will tell you about that. It takes time. And then eventually we have to go back to the coroner's court to issue a report. So that takes time.
Back to the 71-year-old male. It's the case this morning. The information we have is that, yes, many years ago there were thyroid problems, but there is no further information in the system of the hospital authority. And he got the injection from a private clinic. If we look at the medical history over the very short time, that is from the attendance at A&E to the time the person died, we only have limited information. We have to refer the case to the coroners before we get further information about the cause of death. So far, this is the information we can share with you. We don't know about that either. We only have about a dozen hours or so. We don't have that information. From the information we have, is something that happened many years ago. I think it's something in the past. I don't think there is any direct link. Sorry, speakers off mic. The information I have is that the inoculation was done at a private clinic. Sorry, speakers off mic. The speaker is not coming through. Well, about the allergy to prawns. I think it's quite common to be allergic to food stuff. If you suffer some kind of drug allergy, we advise you put the inoculation on hold. Consult your family doctor. You can also get consultation at the outpatient clinic in relation to allergy. But even if you get inoculation of influenza, well, there will be similar cases. There is an antihistamine that will address the problem. The condition can be controlled within a very short time. If you're concerned, go to talk to your family doctor or seek medical attention from the allergy outpatient unit. It doesn't put you in harm's way if you postpone the inoculation for a little bit. Sorry, speakers off mic. For endocrine doctors, and if a patient needs insulin, then we will always emphasize to them the importance of their diet as well as the injection of insulin. If the patient is unwell and they want to do certain things, they have to exercise care. If they suffer from similar conditions, they should see a doctor as soon as possible. You mentioned about the responsibility of doctor. Under Cap 599K, under Section 10, there is an exemption. As you know, that, the research and development of COVID vaccine is greatly compressed to address this problem. So in relation to vaccine administrators, we want to give them a certain kind of protection so that the immunization program can successfully start. The exemption reads that if the administrator, in good faith, administered the process And if the risk comes actually from the vaccine, then the administrator is absolved from civil liabilities. However, it's also a doctor and patient relationship. So as to issues relating to that, we will follow the established mechanism. We'll first talk about the data available from Sinovac. They get the endorsement from the advisory panel as well as the Center for Health Protection. The vaccine has been approved based on phases 1 and 2 clinical data. And the data shows that it is safe and effective. For phase 3 clinical trial, there is little data on elderly people. But the advisory panel on COVID-19 vaccine is of the opinion that the benefits far outweighs the risk. And that's why they have made the recommendation. For ongoing data provision, I will defer to my fellow panelists. Should chronically ill people be given detailed guidelines? Let me say this. The contraindications is that if you suffer from serious chronic illnesses, then you should put vaccination on hold. And if you suffer from some other illnesses and you don't know whether you're suitable to get inoculated, then go see a doctor. Get an assessment done. For those who are chronically ill, they should first get assessed by a doctor before they decide whether to get inoculated. The guidelines has been discussed with the Academy of Medicine and other medical organizations. There are many types of chronic illnesses. Well, if we have the same indicator for someone who is in their 80s and someone in their 60s, the implications will be very different. If someone is suffering from some kind of illness and they don't know whether to get inoculated, then they should first see a doctor and get assessed before they make a decision. That will be the most appropriate course of action. Well, in relation to the mechanism, the Secretary for Food and Health has imposed conditions that safety reports will have to be provided regularly. As I've mentioned previously, in relation to fatality cases, we have asked Sinovac for data. As at 28th of February, they have supplied over 44 million doses. There are 56 fatality cases. The age range is 26 to 103. There are 20 cases that are related to coronary or cardiovascular diseases. They've been assessed and found that they are not related to the vaccine. In relation to the causality assessment by the expert committee, when a case is referred to us, we will first conduct in-depth research on information. We will talk to the hospital and speak to the doctors to get the information about clinical information. We also obtain laboratory information. We will also ask about their family medical history. In relation to different community immunization centers, we will also ask for the information of the vaccine, say, for example, the batch number, whether there are other adverse events on the same day, whether there are other problems from the immunization. So there is a lot of work to collect information. We will also follow the established guideline of the WHO. Today we have handled 20 cases. There are usually 4 different categories. One is consistent with vaccination, the other one is non-inconsistency, indefinite or unable to be categorized. For uncertain cases, is because we cannot establish a link. For consistent and inconsistent, say for example, if someone suffers from dizziness or headache, well, these are consistent, common side effects of immunization, so they are consistent cases. But there are other cases when the patients complain about an upper respiratory infection, and looking at the medical history, it is not related to immunization, so it is inconsistent.
The gentleman at the back on this side, yes. I'm from RTHK. Regarding the case of the patient passing away today, have you received the medical records? Have you made inquiries into the circumstances of the vaccination? Were all the procedures followed? Regarding the first 2 cases of fatality, well, it appears that you need to advise citizens with vascular diseases to consult medical opinion before going to vaccination. And then so far, for those involved in the adverse events, many patients are elderly patients. Would you play safe and do the following? That is, you will suggest that the potential recipients of vaccination to consult a doctor first. Would you make it mandatory? That is, anybody above the age of 60 or anybody with a chronic disease, so that you get them to have this confirmed in black and white, so as to further reduce the number of deaths or the number of adverse events. Let me answer the first question first. Regarding the latest case, that is the death of a 71-year-old male, we did ask the relevant private doctor. Everything shows that it was a normal case, nothing in particular. As to the first 2 cases, well, for the first one, there was a serious cardiovascular problems. And then regarding the second case, it wasn't that serious. So regarding the aortic dissection, it could be something which is inherent, or it is a matter of degeneration. Well, if somebody has chronic diseases and there are certain signs like coronary heart diseases, you have shortness of breath, you have chest pain, etc. If it hasn't been brought under proper control, for such patients, we would strongly advise them to consult their own doctors, their own family doctors, and have the conditions brought under control first before receiving their vaccination. That's much better. As to the other cases, say, for example, I think it's a matter of comparison with the benchmark figures, like the daily number of cases. If the results, when compared with cardiovascular cases and cerebrovascular cases. If the two sets of figures are similar, then we don't see a link as to whether we will make consultation with a doctor mandatory. We just want to emphasize that the vaccination program itself is entirely voluntary. So what we want to do is to bring the pandemic under control as soon as possible, and we hope to do so by vaccination. We need to emphasize that we have got expert committees, we have the joint scientific committees, and we have experts overseeing the matter. We believe that getting vaccinated will generate more benefits. And we hope that the community outbreak can be sort of reduced, and a high coverage rate is the most important factor. So throughout the world, you can see that where countries have got a supply of vaccines, they are rolling out the vaccination program at full steam. So for our vaccination program, we really hope that there will be a high coverage rate for the sake of protection of public health. We have also got this monitoring system for the sake of safety, so as to identify the adverse events, hoping that they are not being caused by the vaccines. So we'll be joining hands with the experts and we'll work hard in this regard. We'll have an English question from the reporter from the back.
On the Morning Post. How do the experts view the rate of the 3 deaths, or now 4, among the 93,000 doses of Sinovac vaccines administered in Hong Kong? It seems pretty high compared to the 56 death cases among the some 44 million doses administered worldwide. So why does the rate in Hong Kong appear to be higher? My second question is, most of the cases severe adverse cases have pre-existing coronary artery diseases before the vaccination. So can the experts confirm whether there are any risk factors for people with pre-existing coronary artery diseases when taking the Sinovac vaccine? And my third question is, the mainland does not vaccinate people aged 60 or older with their Sinovac vaccines. Why does Hong Kong proceed to vaccinate elderly people in the scheme if even mainland China doesn't do so? And my last question is, can you give an overall assessment of the risks of the vaccination, again, given that one death case now, the 4th one recently, is yet to be ascertained, as there are no details yet? Thank you.
So first of all, I think that when you say that the overseas, there are like 56 deaths in 44 million vaccinees, and then in Hong Kong we have 3, in fact. So I think the important thing is that these cases are currently, we find that they are not associated with the vaccination. So if you count that they are not associated with vaccination, they will not be counted as deaths resulting from the vaccine as such. So, and of course we'll have to wait for the detailed final report to confirm that. That's the first thing. And the second thing, of course, is that in terms of the coronary arteries, is that we know that people who have poorly controlled coronary artery disease or ischemic heart disease, they will have higher risk, of course. In fact, if they are, whether they are vaccinated or not, they will still be at risk of having a sudden death. So I think it's important to compare those who have received the vaccine with the so-called baseline in people who subsequently developed ischemic heart disease or myocardial infarction, and of course comparing to the death in terms of the daily or the annual incidence, people who actually succumb to coronary artery disease. And of course, in terms of the vaccination program in China, in mainland China, of course, they are currently recommending people between the age of 18 to 60 to get vaccinated. But there's a likelihood, of course, that the program will be extended to those above the age of 60. So I think it's difficult to comment the approach of the vaccination program. But important is that in terms of the expert advisory panel as well as the scientific panel, we have had scrutinize all the data for especially not only for the people with chronic illnesses, but also for the elderly. And from those data, and also from our experience that in the third wave that a lot of elderly people have succumbed to COVID-19, based on these data, we have the scientific committee have come to a conclusion that the vaccine should be prioritized to elderly people and of course to chronic patients with chronic illnesses. And that is the rationale behind.
Right. Okay. Right. Okay. Yeah. I would like to supplement what Professor Hong had mentioned. First of all, we would anticipate and we will expect there will be an increase in number of these adverse events related to vaccination. Mainly, first of all, every day we have thousands of patients, visiting our healthcare system. And with the rollout of the vaccination screen covering more and more groups of people, we would expect many of them who are already patients of the healthcare system, they may recall history of vaccination. So this is not unanticipated, right? With more and more people get vaccinated, if up to 70% or more, then most of people who are visiting the healthcare system, they would have a record history of vaccination, right? This is number one. Secondly, we have one of the excellent healthcare system in the world. So we have a very robust surveillance system, and we are doing that in a very vigilant way. Especially for this adverse event post-immunization system, all the healthcare professionals with attention on the COVID vaccine program, they know they need to report any incident, be it minor incident or severe problems, they would report. So that reflects the effectiveness of this system. That is why on a daily basis, we are receiving some reports, all right? And in terms of the risks associated with the vaccination, as Professor Hong had mentioned, indeed, if we could not establish the causality or the causality between the vaccine and the adverse event, then we cannot conclude any risk. All right. So unless you can conclude that certain events are related to the use of vaccine, then we can calculate the risk. But up to this moment, there are insufficient evidence, right? But we will be keep very vigilant monitoring on how all the events, and also we will very closely monitoring the effectiveness of the vaccine program.
Next question, the lady at the front. I'm from the Apple Daily. I'd like to ask about the 71-year-old male. Just now, you talk about his health condition. So far, is quite good, but he died after 4 days, and the cause of death is still undetermined. When all these things are happening, why don't you put a stop to the immunization program? Just now, Mr. Chen said that according to latest information from Sinovac, there are 44 million people being vaccinated, 56 deaths, and 20 of them died because of coronary cardiovascular illnesses, and there are 3 people who have died in Hong Kong. Is it because Hong Kong's unfortunate? On the mainland, those who are above the age of 60 will not be allowed to get vaccinated. But in Hong Kong, those who are above the age of 60 are the priority groups. Are you treating them as guinea pigs to get more clinical data? You don't even have a phase 3 clinical data. So based on what can a coroner make a decision? If it is found later that it will trigger a stroke or accelerate certain illnesses, who is going to be held responsible? If it is an indirect cause, are they eligible to apply to the indemnity fund, or do they have to wait till a ruling from the coroner's court? Let me first answer part of your question. From the available information we have, there is insufficient information on which we can establish the cause of death. The coroner will have to find out the cause of death, say, for example, cardiovascular illness, a stroke, or cerebral vascular illnesses. When the expert committee has obtained the information, then we will take up more information that was unknown to us, or data that was unknown to us, before we can compile a causality assessment report. In relation to the case when the patient died after a short time, that will be the course we have to take. In relation to phase 3 clinical data, we have already obtained it. The advisory panel on COVID-19 vaccine has gone through the clinical data of different phases. For phase 3, there is data from Indonesia, Brazil, and Turkey. We have information about the efficacy as well as the safety. The sample size may be small, but we still have sample from the elderly group. The Brazilian data shows that there is only one case with heart diseases. The number is rather small and is not related to immunization. So we have phase 3 clinical data. We have gone through all the data. The Joint Scientific Committee has already looked into possible complications, and they have made a decision that those who are above the age of 60 should be made a priority group. The government set up a $1 billion indemnity fund. There are two conditions: proof from a registered medical practitioner saying that the incident is related to immunization. 2, an assessment will have to be conducted by the expert committee that it is related, or it is not decided, or it cannot be ruled out. There is this indemnity fund. Because for someone who want to get compensation, they will have to go through a very lengthy litigation. But some people would need the money urgently. So if they meet the conditions I've mentioned, they can get some compensation from the indemnity fund instead of having to go through the lengthy litigation. Let me add that about the 20 cases, they're included in the 56 cases. The age ranged from 50 to 98 years old, and the final finding is that they're not related to immunization. The lady over there. I'm from TVB. Another reporter asked about the death rate. Comparison between that in Hong Kong and that supplied by Sinovac. Is it rather high for Sinovac? There are patient groups saying that there should be registered nurses or doctors at the immunization centers to assess the health conditions of elderly people. Would you consider that, or would you make it mandatory? About the death rate, as I've said, that it's a very short time. So far, there are 3 cases. The first two cases are not directly linked to inoculation. So you can't count them as death cases related to immunization. Over a longer period of time, we will be able to make a comparison with overseas data. In every immunization center, there are doctors from the A&E and experienced nurses who are at these centers. They would conduct assessments on elderly people or people who may suffer from illnesses, and then they will give advice. As to whether there will be more safeguard placed at these centers. Well, if you want to make a booking online, we have clearly set out all the contraindications. That is, people who are not suitable to get inoculated, they will have to check relevant boxes before they can proceed. These contraindications include allergy to the substance used in the vaccine. There has been a history of serious allergic reaction or serious neurological conditions, uncontrolled serious chronic diseases, or people who are, or women who are pregnant or are lactating. Well, if you suffer from these conditions, you should first see a doctor. If you have chronic illnesses, if you are not sure whether your disease will be affected by the inoculation, then you will have to first see a doctor. Well, at these community immunization centers, you will find registered doctors as well as nurses there. When after a registration is made, then they will have to go to the information station where they will be able to see the information I've just said. If they have any questions, they'll be able to ask the doctors and nurses present at these centers. And we have been receiving inquiries and we've been doing assessments. We've dealt with cases that in which people are unsuitable to get inoculated. And when they have entered the inoculation station, and just before inoculation, the personnel involved will ask whether the person is suffering from any allergic reaction. In relation to Sinovac vaccines, in the recovery area, the patient is required to stay there for 30 minutes, which is longer than the 15-minute required for influenza immunization. This gives us the opportunity to observe the person who's just been inoculated. If there are problems, they will be handled promptly. We have the surveillance system. To make sure that if there are any problems, they will be quickly identified in the network.
The lady in black, thank you. I'm from Mingpao. First of all, we have got a couple of cases in which patients have died or are in critical conditions. You've judged that they have got nothing to do with the vaccination. In relation to the background and medical history of chronic diseases already known to you, under normal circumstances, even without the vaccination, under what circumstances would they fall into a critical condition or they will pass away? Regarding the couple of cases that we are interested in, have their conditions been brought under control? If their conditions are unstable, uncontrolled, does it mean that there is a loophole in the system? as they have been allowed to be vaccinated. And then Professor Hong talked about diabetes, aortic dissection, and coronary heart diseases, etc. So I want to know whether we have got more cases than that indicated by the baseline figures. And then we have got 3 fatal cases against a background of 90,000 doses administered. So the percentage is 0.003%, while the global figure is 0.0013%. What is your interpretation of such a ratio? Is it higher than the global average? Can you, at this stage, rule out that such cases have got nothing to do with the vaccination? That is, the death has got no relationship with the vaccination, not even indirectly? Are you still maintaining the assertion that there is a positive benefit-risk profile? Are you going to advise a certain group of people to take BioNTech instead of Sinovac, as the benefits outweigh the risk? Well, last week there was a case of 63-year-old man and a 55-year-old lady who passed away. In both cases, they did have chronic diseases. In one case, he suffered from serious coronary heart diseases. And then in another case, there was hypertension and hyperlipidemia. Well, for the first case, I think for his chronic diseases, they had not been brought under proper control. He had chest pain and he had shortness of breath. So it had got nothing to do with the vaccine. Well, we believe that even without the injection, there was a probability that his conditions might worsen over a short period of time. For the 55-year-old lady, for the dissection of her main artery, again, it has got nothing to do with the vaccination. Well, equally, there weren't any signs. Well, I would say that even without the vaccination, it was expected that her case would worsen or would become acute over a short period of time. So it was not related to the vaccination. Now, as to the baseline figures, as I have said, the time was too short for us to make any comparison. But still, the ratio is on the low side. As we have said, on a daily basis, we have got about 10 persons dying as a result of coronary heart diseases or stroke. So when you look at the figures, we believe that the current figures that we have got are indeed on the low side. As to the question of the baseline figures, just now we have said that we do have a surveillance mechanism. There are 2 aspects. First of all, the WHO has said that the vaccines have had their sort of clinical trials much compressed. So we need to get reports. And together with the Hong Kong U, we have entered into a partnership. The Hong Kong U will be collecting big data. So from both public and private institutions, the Hong Kong U will be watching out for 40 plus and another 10 plus categories of conditions. So the information will be collected for analysis. The WHO has already said that, first of all, for the general population, we need to have a surveillance. That is, we need to look at the baseline figures of the general population, say in Hong Kong. And then we try to see whether there's a significant increase after the vaccination program. So we do need to collect such big data. And then after analysis, there will be discussion with the expert committee to see if we need to bring up the matter with the pharmaceutical manufacturers to see if we need a clinical study targeted at a particular set of signs or presentations. Yes, indeed. Well, there are 2 points here. First of all, if I may add to the answers, we have this expert committee on clinical events assessment. We are having meetings on a weekly basis, except when we have serious cases in which patients died or patients got admitted to ICU. And then in the light of the media interest, we'll be meeting more often and let you know. And as I have said, we need to collect a lot of information. We need to have the causality assessment. So we do have weekly meetings to assess all the cases. Come Thursday, we are going to have an online publication of the relevant figures. And then there will be information as a result of the positive assessment, and it will be published. Sorry, speaker is not coming through. Sorry, the reporter hasn't used the microphone. The speaker is not coming through. Interpreters cannot hear her question. Let me take the case of the 83-year-old patient. I think the key point is that he did have a lot of chronic diseases, diabetes, carotid atherosclerosis, hypertension, and a history of stroke. So there was a number of factors. Even without vaccination, I believe that as a result of such issues, probably within a short period of time, he might have also developed such signs and had to be admitted to hospital and even ICU. So it's not related. We need time to have more information so that we need to have more assessment of other data. I know that we have the computer-generated data to show that his coronary heart disease itself was already at a very serious stage. I don't think it's stable if you have got such a serious cardiac catheter problem. It depends. It depends on the patient's own perception. And also, generally speaking, you need to see whether the signs are presented. As I have said many times, if you have the symptoms, you need to make sure that the disease have been brought under control before you get vaccinated. Sorry, speaker is not coming through.
The speaker is not coming through. The interpreter cannot hear. The speaker is not coming through. The interpreter cannot hear. The speaker is not coming through. The speaker is not coming through. Let me supplement about the last case, 71-year-old male. We've asked the private doctor. There has not been any adverse events following immunization. Sorry. We don't have direct information here. In relation to the 72-year-old female with diabetes, from the medical record, well, she complained about feeling lethargic after immunization. That's quite common. The patient told us that she did not receive insulin jabs. As far as we know, that she was prescribed with insulin as well as medication for diabetes. Well, for patients who are given insulin as well as medications for diabetes, they have to be careful with their diets, and they may suffer from blood sugar being too high or too low. We think that because she skipped 2 jabs of insulin, her blood sugar has shot up significantly. That's why she has to be hospitalized. It says that she's suffering from the severe diabetic ketoacidosis. Yes, we mentioned that yesterday, but there is an update. The diagnosis is hyperglycemic hyperosmolar status. It is a complication of high blood sugar, but there is a different clinical data. That's why there is a different diagnosis. You talk about the 1st of March and then the 2nd of March when the immunization was received. It's the 1st of March. That's the end of the press conference. Thank you. Thank you. Sorry, speakers off mic. We think we're confident. For the death cases, so far we know that they're not related to immunization. So we strongly encourage members of the public to receive the immunization, especially those who are high risk. Sorry, speakers off mic. The speaker is not using a microphone.
Whether it's related to the vaccine. If it's not related to the vaccine, then it will not be counted as related to the vaccine as such. So this is the first thing. Second thing, of course, is that we will compare this to the baseline incidence that we have for each of the diagnoses. So if there's an extraordinary increase in the number of incidents in certain diagnoses, then that will be an alarm or an alert for us to reconsider the vaccine status, the vaccination program status. So this is that we are constantly assessing.
Sorry, speakers off mic. The speaker is not using a microphone. We'll closely monitor the situation. We do that every day round the clock. Should there be a serious adverse situation, we will pass the message on to the expert committee as well as the advisory panel. Well, how come the 3 death cases, when you say that they're not related and they're not counted? May I add, well, out of the 56 cases, the 20 are counted. But they are not related to the vaccine. Sorry, speakers off mic. The speaker is not using a microphone. I understand. Well, the causality assessment, when a case is referred to us, the data is included. What Professor Hong said is that we would include the data. It's just that the causality finding is that it is not related to the vaccine. The most important part of the message is the last one. As Professor Hong said, should we spot a serious adverse conditions, then we would update the situation. Say, for example, updating information of the product, and we have to talk to the pharmaceutical company to see if there are similar cases globally that's worth follow-up action. And that is an advice given by the WHO as well. Sorry, speaker is off mic. The speaker is not using a microphone. Well, let me make a brief conclusion. All in all, the use of a vaccine in an immunization program should be one that is deemed safe, of high quality, and effective by experts. Undoubtedly, the 2 vaccines that are put to use in Hong Kong have gone through the Joint Scientific Committee as well as the advisory panel. There is a large scale of application of these vaccines. When a large population is involved, of course, further data will have to be collected. That information includes safety information. That's why we have the surveillance program. As Dr. Lee and Professor Hong mentioned, we have looked at all these cases. So far, there is no sufficient evidence showing that these cases are directly related to the use of vaccines. So the benefits far outweighs the risk. We would like to continue with the immunization program. There is still local transmission chain. So far, over 11,000 people have been infected, and over 200 people have died because of COVID. The epidemic has not subsided. We need to make use of a safe, effective vaccine, and we want it to cover as many people as possible. Our stance is the same as that in other places. We want to protect the people as well as to cut the transmission chain. Thank you.